Time to talk health on Wake Up Nigeria. And doing justice to that this morning is Dr. Dorothy Jeff Namani. Dr. Dorothy, it's so good to have you in the studio with us this morning. Now, we're talking about emergencies, what to do in case of an emergency. So tell us, you know, people look at emergencies in different ways, different angles and all. But first, from a professional doctor, I'm using that word professional,
yes,
because we know how the word doctor is abused these days. But from you, what would you define as an emergency?
Okay, so an emergency is any illness or condition that is time sensitive and can lead to death if not addressed.
So an emergency is one that can lead to death if not addressed.
Yes.
Now, I know there are different types of emergencies, and there are also different types of locations to head towards in case of an emergency. Many people don't know this. They just say, go to the hospital.
Yes.
It's when they get to the hospital, they're told, oh, no, not medical emergency, go to surgical emergency.
Exactly.
You know?
Exactly.
Most people just feel emergency is emergency. So can you tell us the different types of emergency there are?
Okay, let me start by even saying that there's a lot of confusion in Nigeria. You hear people use that word emergency. You know, should I say carelessly? They just use it. But it could be that a health condition is urgent. So that's urgent care. Maybe you're really sick, you have malaria and all of that. Or somebody, like the one I had yesterday, a lady called me, said, oh, it's an emergency, doctor, I'm in the hospital. I said, what's wrong? He said, oh, my daughter, her tummy is paining her. I said, no, that's not an emergency. That's an urgency. So there's a difference between, you know, the two. So I need to clarify that.
So urgency has to do with things like, you know, body pain,
maybe it's hurting, you know, exactly, severe.
Yeah.
That's the word, is severe body pain. But there is no threat to life.
There's no threat to life.
Emergency,
immediate threat to life.
Immediate threat to life. So the emergency is when there's an immediate, like I said, it's time sensitive and there's an immediate threat to life. Okay. So that's the difference. However, in emergency situations, you know, unlike what you have in developed countries, where is built and everything is centered on a national level, you know, they have national response. We don't have something like that here in Nigeria.
Yeah.
So I always advise people in terms of your emergency preparedness, because as a person or as a family or as an organization, you need to be prepared for emergencies in case they happen. And emergencies is not just things like, people think that there must be blood everywhere, accidents. It could be a cardiac arrest. It could be somebody who is already diabetic going into the crisis or whatever. You know, so we need to understand that we need to have that emergency preparedness. However, in a place like Nigeria, it becomes even more serious, whereby we don't have the infrastructure to address these things. We don't have the skilled professionals. We don't have the, even when you get to the hospitals, you don't have a well-systemized trauma center. Even the communication there, because in an emergency, what they do to you before you get to the hospital is actually very important. Remember, like we said, it is time sensitive. So these are all the levels to consider. How prepared you are already, that's your plan, then pre-hospital treatment, because if we have the first responders, they should also already be taking the person in an ambulance, you know, and resuscitating the person before the person even gets to the hospital. And then at the hospital, that's when, you know, the whole trauma, triage, and everything happens before the person is now treated. Now, so we are suffering at all levels.
Now, in Nigeria, if you want to get somebody in an ambulance, it has to be either a roadside incident or something related. Now, in most cases, people have to take their patients to the hospital themselves in case of an emergency.
Yes.
So how can we know what is needed to do immediately, especially when there's an emergency in the home? How can you handle such situations?
Oh dear, you have to become a first responder. You have to be trained.
I think most Nigerians ought to be trained as first responders.
Well, not exactly, because I mean, people are trained for that particular, but you need to at least, as a person, you know, have like first aid at home. First of all, have your first aid, things that you can easily, as a lay person, you know, apply to even help the situation. And I also say that people should ensure that they partake in some promotive or preventive health situations so that if there are illnesses like communicable disease or stuff like that, you're vaccinated or you take action not to even have it at all. When you look at Nigeria, that's why I say it's peculiar, because we are infrastructurally poor. So you don't even know where to begin. So what you need to do is to ensure that you're well informed where to get help. At home is just the first aid that you can try. You know, have a well-equipped home first aid box that you can apply the little safety thing before you get to the hospital.
I wish we could talk about all those things that we should have to check emergency, for emergency measures in your home. What are those things that you should have in that first aid?
That's why information now is important. You have to be informed about your own health. So depending on what conditions that you have, let's say for somebody who has diabetes, and I keep talking about diabetes because it's prevalent it's one of the chronic illnesses that are common here. People you have, depending on your level, you see where it gets complicated. If you're the type that has to take insulin, you make sure that you have that at home. If you're in terms of people who have a high blood pressure, you make sure that you have your kits, you check your blood pressure. You can also check your blood sugar and all of that. So it depends on what you have, on what, should I say, medical illnesses concern you. So that's what happens. But, well, bandage, something to stop blood, those are the general ones that you should have. Something like paracetamol, for headache or for pain relief in case the person is in pain and stuff like that. As simple as it sounds, they are very, very important.
All right. So basically what we've been able to learn is the difference between urgency and emergency, particularly when you're seeking medical help. And also the things you need to know, the things you need to have, especially now that you're expected to be more or less an untaught first responder. But really, thank you so much for your time, Dr. Dorothy Jeff. Always pleasant to have a conversation.
It's my pleasure.
Thank you so much.